Hey, thanks for checking out this video. Today we're going to talk about bedside manner. This video is for anyone who has had to interact with a doctor, and it's particularly for any doctors who may want to consider some things they could do to up their game in terms of bedside manner. We're going to talk about a website, ratemds.com. We're going to talk about the secret sauce that is your personality and how some patients really like your personality and some patients may not like your personality. We're going to talk about one of my local mentors, a fellow by the name of J.B. Walker, and we're going to talk about the importance of time horizon to the interaction that happens between physicians and patients, because I think a lot of time expectations around what you're trying to get out of an encounter may affect your perception of bedside manner, either positively or negatively. And then we're going to talk about a few little tips and tricks for improving interactions between patients and doctors, although this will be a topic for other videos as well. Thanks so much for joining me. Okay, so this is ratemds.com. I think it used to be called Rate Your MD. It's a site where patients can provide a review of their doctor. It's generally initiated by the patient, although I think some physicians may ask their favorite patients to provide reviews, and that may help to boost ratings. For the record, I have never spoken with my patients about this website. And when I've looked at the postings on this site, I really can't identify any of them from the postings that are there. Because this is generated by patients, there are errors, and I'll show you one. The most significant issue is that anyone can leave a review. There's no verification that they are a patient that has seen the physician. It could be an angry ex-spouse. It could be the doctor's children trying to provide good reviews so that they can, continue to play hockey. So it's a bit of a Wild West situation. Having said that, it does provide some either entertaining or heartbreaking revelations about issues related to bedside manner. So with that disclaimer in mind, let's take a look. Okay, this is Google, which I'm sure all of you know. We're going to rate MDs. And here's Rate MDs, doctor reviews and ratings. And here we go. So let's check out my profile here. And doctor's named George Dresser in the world. Appears that there's only one. Now, obviously there's issues with this website. I am not an endocrinologist, so somebody was able to put in information about me that isn't accurate. So I'm not an endocrinologist. I've only had 11 reviews, which I'm kind of happy about because I think the fewer reviews, probably the better. Let's click and we'll see what some of these reviews show. So, all right, here we go. Oh, it's recommending other doctors that I should check out. All right, my ratings. So very attentive, helpful, and also very knowledgeable. 5 out of 5, that's great. Brilliant doctor, who I believe also has a PhD in pharmacology. That is true. Very professional and answered all my questions. Dr. Dresser and his staff were friendly and understanding. I feel good. Oh, that's great. That's very nice. He's the best doctor, explains their situation, and is a wonderful doctor. I find that many patients actually say that the doctor is the best when they put reviews in, so that's very nice. Very friendly, knowledgeable. Aha, they identified that I'm not always punctual. This guy's better than the Big Lebowski, and 5 out of 5. So pretty positive reviews. Oh, there's one. This guy's a Big Lebowski. He doesn't know what causes arrhythmia. So obviously people can say whatever they like. The best doctor I have ever come in contact with. He is so helpful and has a great personality. He always makes sure I'm taken care of. So, so that's my profile on ratemds.com. And you can see that there really is a flavor here for what your bedside manner might be, albeit filtered heavily by the interaction of the patient in the clinic. The other thing to keep in mind is that I could have entered my own reviews here, which I promise you I did not. And, you know, an angry colleague could put reviews in here. Anybody can put a review in. So, yeah, that is what it is. Okay, so here I have pulled up some reviews that I found for a couple of physicians that I know personally. I think of these people highly. They are people that I might have known from medical school and otherwise. And I just wanted to show you the flavor of some of the reviews. So on the left panel, we have one physician, and the reviews are all very low. Terrible attitude, makes you feel stupid. I will never go again. Going to this doctor was the worst decision of my life. I'm still so upset from my experience that happened months ago. I was misdiagnosed, etc., etc. The next one, if Satan himself is a doctor, he sadly set up office in Ontario. This guy is abusive beyond means and should not have had kids, staff, or patients. I was terrorized by this man. Okay, next one. Seriously, a terrible doctor. I agree with all the comments regarding his knowledge, his ability to understand, etc., etc. So a series of rather negative portrayals. In contrast to that, another physician that I know, and what you'll notice here is that there are some ratings that are exceptionally high, 5 out of 5, and then other ratings where it's 1 out of 5. So, and 1 out of 5 being the lowest you can go on this. So, you know, my mom went to see this doctor. What a complete asshole. I saw this doctor for the first time a few days ago. They were great in every respect. This doctor is a dangerous combination of arrogance and negligence. This doctor is terrible. And so a mixture of opinions one way or the other. And I think that's the most important one in terms of trying to understand this topic of bedside manner. So it's important to take a minute and talk about what I refer to as the secret sauce. Your basic personality has a lot to do with bedside manner. And I view that as the secret sauce that flavors all of your interactions, whether they're interactions with your family, friends, or your patients. I acknowledge that I'm not a psychologist, but my feeling is that most of us have developed whatever our secret sauce is by the time we are young children. What does this look like? Well, you know, here's a nice looking family. And this little gaffer here looks pretty respectable. He's got a nice suit on. And, you know, if you take a look at this, you'd say, well, his secret sauce is probably pretty tasty. Perhaps, given the picture and the way everybody looks in this picture, his personality is largely determined by genetics. Perhaps he just inherited this. On the other hand, here he is hot rodding on a Honda Trail 70. So maybe some of his personality is determined by his environment, his rather unconventional upbringing. The question is, how much of the secret sauce that you bring to the interactions with your patients is related to your basic personality, your genetics on one hand, your environment on the other. And obviously I can't tell you what that is, but I think it is important that you take a minute to think about how your basic personality flavors your bedside interactions with your patients. In terms of exploring your own personality, perhaps your own personality issues, it's worthwhile doing a little bit of reading around this. This is one example of an Audible book that I consumed. It's by a fellow named Mark Leary from Duke University, and I found it very interesting and very helpful. The other thing I would say, that if you are being called Satan by your patients, you may want to consider some professional counseling. Professional counseling is something that I think everyone should do at some point in time. It is very helpful. And I think before you can interact well with the people around you, you do need to have a really foundational understanding of your own personality, your own secret sauce. People pay lip service to the concept of bedside manner, and I don't think that many physicians think that it's actually an important issue. But many of my referrals are because a patient didn't like the bedside manner of their previous specialist. Dr. J.B. Walker was a professor of medicine at the University of Western Ontario, and he said that a truly successful physician will be available, affable, and able. His mentees would say the 3 A's of J.B. Walker. And really, when we're talking about bedside manner, we're talking about what it means to be affable. Perhaps in honor of J.B. Walker, Western University has actually branded itself as a patient-centered university. And many of the classes are prefixed with the moniker, for example, clinical methods teaching isn't clinical methods, it's patient-centered clinical methods teaching. The question is, how do you teach a physician to be patient-centered? There are many strategies here. I was personally taught to fife my patients. I was supposed to ask them, what are your feelings about this? What are your ideas? How is this affecting your function? What are your expectations of me and of the situation that you're in? Dr. Mary Moore is a colleague of mine and mentioned one of her mentors who had a little trick. When he was going on inpatient rounds, he made a point of sitting down with the patient and presenting himself as though he had nothing better to do, as opposed to standing at the end of the bedside, tapping your feet, kind of waiting for the patient to stop talking. And what he found after many years was that in fact his rounds went faster when he portrayed himself as someone who was not in a rush. The patient wouldn't be concerned, they wouldn't ask a lot of questions, and the rounds would go more simply. So everybody needs to develop their own strategies for how they can work in a patient-centered way and develop a good bedside manner. My 2 cents on this issue is that the most important thing that you can do with your patients is establish trust. The sense that I care about the patient's well-being and that looking after that patient is the most important thing that I can do. With most normal patients, this is relatively easy to do. I have my own personal strategies. When I'm on inpatient rounds, I walk into a patient's room, hopefully not in the time of COVID when I'm gowned and gloved, etc. But the first question I always ask a patient is, did you sleep okay last night? It's just a general caring question. If they say no, then I follow up and say, well, why not? And often the answer to why the patient didn't sleep well gives me very valuable information that allows me to be more able. It allows me to focus on the things that are really affecting that patient's health. In the outpatient clinic, no matter how behind I find myself, and those of you who are my patients may know that I sometimes find myself quite behind, I always start interactions with an open-ended question, and I let the patient talk uninterrupted until basically they've exhausted that initial issue. I find it very rare that I have to interrupt or redirect a patient after that first question. And I think starting out with the patient understanding that you really do care what their experience is very important for establishing a healthy bedside manner. I want to establish a bit of a conceptual framework for you when you're having some of these interactions with patients. This, I think, is one of the reasons that some doctors are rated high in some areas and then low in other areas. So if you look at this schematic, we have time stretching from the immediate on the left side of the screen to, many weeks or years down the road. And what a patient generally wants in the immediate sense is someone who cares. And so if you can portray that in one way or another, then you will be viewed as having a positive bedside manner. Patients generally want relief of their symptoms, whatever those are, and that can be immediate relief, it can be relief within hours to days. And those are the things that I would refer to as making you an affable person. If you're able to meet a patient where their need is, what makes you an able physician is the ability to improve function for that patient, to prevent negative outcomes, and really to relieve long-term symptoms. And those things are the things that I think J.B. Walker would refer to as making you an able physician. In medical school, when we find new recruits, our recruitment strategy tends to focus on physicians who are likely to turn into able physicians, and we have focused less so on patients who may be affable, who have that secret sauce from childhood that may make them a better physician. So I want you to think for a minute about a number of scenarios, and we'll apply this framework to them. The first example I want to use is the issue of opioids. So this is often a place where there's disagreements and strong feelings between patients and their physicians. And so if you think about the issue of a patient who is requesting an opioid from their doctor, the focus is usually on the immediate and on relief of immediate symptoms. So they're looking for somebody who is going to write that script and give it to them as quickly as possible so that they can get to the pharmacy and fill that prescription. The physician often, and certainly regulatory authorities where I work, are more concerned about improvements in function, about relief of bad outcomes, and relief of long-term symptoms. And the trouble with opioids is while they may relieve some immediate suffering in terms of withdrawal, for example, they cause constipation, they cause changes in hormone levels, they cause thinning of bones, they actually decrease your ability to function well. I have had patients in the inpatient setting where they keep requesting a higher and higher dose of narcotic, and it's apparent to everybody around them that as they do that, they spend more and more time in bed, they become more and more constipated, and really their overall function and their overall health status is deteriorating as they continuously request opioids, where what they really need is actually fewer opioids so that they can start to function better, their bowels can start to move. And so this results in a conflict scenario where, you know, the patient may accuse me of having a terrible bedside manner because I wasn't willing to satisfy their need for immediate relief of symptoms. But understanding that then allows me, when I'm talking to that patient, to explain that my concern in deprescribing the opioid is actually for long-term outcomes. Here's another scenario. So blood pressure medications really don't have a major impact on immediate symptoms, unless of course a patient is having a hypertensive urgency or emergency. You know, they might have a terrible headache, that sort of thing, in which case giving an antihypertensive or blood pressure lowering medication is a very good way to relieve immediate symptoms. But most of the time when I prescribe a blood pressure lowering drug, I'm thinking about improving bad outcomes in the future and improving long-term symptoms related to their blood pressure issues. In order for that patient to understand that I'm doing this because I care, I need to be able to explain the importance of the long-term effect of these drugs. And if I do that effectively, then I can leverage that immediate need of the patient to have a doctor who cares, and then I might be viewed as more affable. Another example is statins. There's all kinds of misinformation and disinformation on the internet about statin therapy. Many patients come in to me complaining that, you know, they don't feel as well while they're taking their statin therapy. And so in some cases where a patient has already had a coronary disease outcome, and I know that I'm doing a good job of reducing the chance of a bad outcome in the future, which will then subsequently result in relief of long-term symptoms, I need to be able to explain that to the patient, because the patient is not going to view me as a caring physician or somebody who wants to relieve immediate symptoms. In fact, they may perceive me as somebody who wants to make immediate symptoms worse when I give them a statin therapy. But we have to walk that fine line between relief of immediate symptoms and then relief of long-term symptoms. Okay, so the bottom line from my perspective is that I think our medical schools in their admission process often focus on future physicians who are likely to be able, who are scientifically skilled, at the exclusion of affable folks. Perhaps because it's actually difficult to predict how any given person may turn out from a bedside manner perspective. But I think that we do need to focus on physicians who are likely to be affable as well as able. I think that when you think about your personal time horizon, whether you are a physician and you are prescribing drug therapy or managing a patient's difficult issues, being aware of what you're doing, whether you're doing this because you want to provide immediate relief of symptoms or whether you're doing this because you want to relieve future symptoms or prevent disease and disability in the future, is very important. And I think it's also very important that you communicate this effectively to your patients. I think if you are a patient, you need to be able to understand why your physician is taking the perspective they are taking. And I think perhaps one of the most important questions that you could ask your physician is, are you telling me this because you think it's going to make me better, feel better today, or because you think it will help me be alive in 10 years? And I think that the answer to that question will hopefully help you trust your physician, that they really do care about your best interests, and hopefully that will reflect in your feeling about what their bedside manner is really like. I hope you've enjoyed this video. If you have and you want to see more, please subscribe to this channel. If you ring the bell, you'll be notified when I post new content. Thank you so much. If you have comments, please leave them below. If you have ideas for future videos, please leave them below. I look forward to your feedback. Thanks so much.